welcome to a quick talk on the power of social media. Thank you all for coming, and thanks to those watching as well. Should we do some quick intro?
Yeah.
Get started. So, Raihan, should we start with you?
So I'm a medical student, final year medical student at Newcastle. I've been making YouTube videos on getting into medical schools for like 7 years now. And the reason I started was because I found it quite difficult to get into medical school, coming from a disadvantaged background. So the only way that I found feasible to produce free content for other people from similar backgrounds was through YouTube. And 7 years later, it's provided me with loads of different opportunities, and it's essentially turned into a career now. So
brilliant, thank you very much. Hopefully we have a chance to talk about the opportunities it's given to you a little bit later. So if Jonny, if you'd like to introduce yourself.
Yeah, hi guys, I'm Jonny Guckian. I am a incoming dermatology registrar in Yorkshire. I'm also social media and communications at ASME. Please come to our stall and say hello. And founder of Medicine's Medical Education and social media editorial trainee at the British Journal of Dermatology. I like one thing about social media. I come to social media for the memes and the GIFs mainly.
Brilliant, thank you very much. So Marina, if you'd like to go next.
Hi everyone, my name is Marina. I'm an NIHR academic clinical fellow in respiratory medicine, and I have a lot of passion for Twitter and the use of influential and positive social media. That includes social media that is the platforms that we're all familiar with in terms of Twitter and Facebook, but also broader media, including broadcasting, radio and newspapers.
Brilliant, thank you very much. And finally, Karen.
Hi everyone, it's really exciting to be here. I'm tuning in from Australia, so it's about 9 p.m. here, so really good for the time zone. I'm a current junior doctor, just floating around Australia. I was actually living in London and doing a Masters of Sexual Health, but booted back to my country a couple months ago. I run a podcast called Humorous Hacks. Humorous spelt like the bone, and it's a podcast looking at kind of humor and mnemonics for medical education for medical students. So unsurprisingly, my favorite social media avenue is podcasts, though I recently have discovered TikTok, and I think it's the only good thing to happen to 2020. So I'm a big fan.
Brilliant, thank you very much. And I'm Jack. I'm a second year medical student at Birmingham. I'm part of the conference team, and I work at Becoming a Doctor as well. And I help with the media output. So I guess that's why I'm here, and to talk about the power of social media. So I'll bring up a few questions, and feel free to take them where you like. It's a fairly flexible, relaxed session. It probably will be shorter than originally planned, just because we had a bit of teething problems with the technology to start with. So I think for me, the only reason I'm here is because of social media. So it can offer some brilliant opportunities. When I first started medical school, I started a little blog on Instagram, and I didn't expect anyone to be interested in it. It was more for sort of a way to reflect it in a way. But then I gained some followers and people are interested. And then I managed to get involved with Becoming Doctor. Got in touch with Raj, who's organised all of this, and managed to get some great opportunities from that. So I was just wondering if you could talk a bit about the opportunities that any form of social media has given you, perhaps whether it be podcasts or Twitter, where it's taken you and how it's benefited you. So perhaps if we go in the same order as before.
So I think the first opportunity that arose for me was I got offered a Clegg scholarship with the BMJ, and that was to produce videos for the BMJ YouTube channel, which was quite, and I did that in the first year, the summer of first year of medical school, which was quite early on. After that, they then called me back to quite a few events, so they asked me to speak at a few events, and since then I've been invited to speak at various national events. some global health, social media conferences in Leicester. And I'm also a regular co-host on the BMJ podcast now because of sort of close networking with the with the BMJ. I think there's quite a lot of things that are out there for us if you are active on social media, and it is also about being proactive yourself. So, say for example, this is something that I think of sort of it's quite helpful for me. So if I think there's something that I'd like to do, or if there's something that I need to do in the future, and there's a company that provides it, I'd reach out to them, and in return, I can offer a sponsorship on my channel. So, for example, my elective, I had to do an elective. Now, electives are quite expensive and can cost upwards of £2,000. I reached out to a company, and in return, I offered them promotion on my channel. Again, it was something that saved me a lot of money. It was a nice opportunity to go out to Vietnam, a country that I'd probably never go to anyways, and do my elective there. So it's an element of it is being proactive yourself, and the other aspect is opportunities will come your way. Just be open to accept them and say yes when they do come.
Brilliant, thank you very much. And I have to say, Raihan, just quickly, when I was applying to medical school, I actually used your videos for my UK CAT revision. So I guess it's my chance to say thank you.
You're welcome.
Brilliant. And if we move on to
so
Jonny,
I mean, my very, this is show my age. My very first experience with social media was with Bebo. Rather than TikTok was just a glint in someone's eye back then. But no, my first major medical education sort of intervention on social media was with another old one, Vine. And this is something I talk about a lot whenever I kind of go about the med ed circuit. If anyone's not heard of Vine, 6-second looping videos owned by Twitter was mostly used to share videos of cats, as most of social media is. Not necessarily a bad thing. But Vine went from being the most popular app on the App Store to dying a death a couple of years later, purely because it didn't make enough money for Twitter. RIP Vine. Problem was that I've made dozens of medical education videos on Vine, which is called 6-second studying, which is what set MediSense up really from the start. And then when Vine shut down, they said, "Oh yeah, we're going to keep everything up," and now half the videos are gone. That's something that we had no control over. So that really got me started on a journey, which is a kind of a critical journey of social media, which might be a little bit different than a lot of the other kind of unbridled enthusiasm we might get from a lot of people on social media. I think it's important that whenever we engage with social media, we are safe, critical, and quite aware of the fact it's probably, as well as being the most exciting innovation in the last 4 or 5 years in education, but it's probably also the most dangerous. And I'm sure I'll talk about that a bit more later.
Thank you. So, Marina, you'd like to talk about some of the opportunities that you've managed to
social media brings a lot of opportunities. The first opportunity I'd like to talk about is how we network together as a community and how we gauge each other's views. And that's actually really important if we were to use those views to influence policy making or to influence positive change. So I think that's one aspect that's really important. The other important aspect for me from social media is dissemination of good quality content, so that research findings, and this week our COVID-19 study has gained quite a lot of coverage on Twitter, and other educational resources can be disseminated on Twitter. So like Raihan, I also did the BMJ Clegg Scholarship in medical education, and Twitter was a very, very big platform in how we share content to what was then articles, but later moved on to, I'm pleased to say, videos. And that's all really important. And the last thing I'd say is that there's something lovely about Twitter in terms of understanding factors that are really topical and current in society at the moment. So what is trending? What is really affecting people at the moment? What are our priorities as a society? And I think from a research point of view, from an education point of view, and from a policy-making point of view, social media has a huge impact on how our society functions and how processes change over time.
Brilliant, thank you. And Karen, if you'd like to talk possibly a bit about your podcast and what's that offered you.
Yeah, so I started it back in 2016. It doesn't sound like so long ago, but in 2016, podcast was still very, very new. And I started because me and my mate at the time, well, my mate Sarah, still one of my good mates, we used to run a lot of tutorials for medical students in the year below us. And we used to run them every single week. We had an audience of about 20 people in the library, and we always used to have these really stupid mnemonics. We were always a bit embarrassed by them, but it helped us remember things. So we just kept going. And then we were driving a long way to university. I mean, Melbourne's a big place. Sure, none of you have been, but if you ever do visit when this is all over, big place, driving 3 hours a day to come uni. So we were trying to find medical education podcasts to listen to, and we couldn't find anything that was enjoyable, only quite boring things. So we ended up saying, you know, why don't we just make our own podcast? And this was really early on when podcasts were still really in its infancy. We were very embarrassed. We didn't tell anyone about it. We didn't put it on in our resumes. We didn't talk to our bosses about it. We were just like, oh, we won't say anything. And then students started to listen to it. Students started to tell the consultants. And then as it happened, the word just spread and we started to get, you know, hundreds of thousands of downloads. And we were really surprised, and we realized that there's a huge market for it, and we didn't really need to be embarrassed about it. And having silly mnemonics was okay. So now it's probably one of the core things I talk about in all my job applications, in all my job interviews, and it seems to be, I think, the core thing that has gotten me really any job, and I believe it is one of the core things that got me into my master's degree. Finishing up now, and more importantly, I've now got a lecture and tutoring gig at the local uni here, the local uni, Melbourne Uni, which is great. So I think that has all happened because of the teaching experience from Humorous Hacks. It kind of went from something being like, oh, is this a bit silly and I shouldn't tell anyone, to being something that I'm really excited and proud of.
Yeah, brilliant. Thank you very much. So we talked about the power of social media, and of course, power is both good and can be bad. So perhaps we could talk a little about the dangers of social media as well, and especially as a doctor or as a healthcare professional, the sort of professional image you have to come across as, not just in your job, but having that professional sort of persona online as well. If you've had any issues with that, maybe you'd like to talk about those, or if you've got any comments about that. I know what's quite topical at the moment is a vascular journal published a report saying that bikini photos online were unprofessional, something which has since been retracted. So maybe we could talk a bit about that for a few minutes.
I've had.
So should we start in the
yeah? I've had a bit of an issue with a certain department in one of the placements that I'd worked in, and I guess I needed that, but I think there are a lot of barriers against social media, particularly in the north. Just because a lot of people don't really understand what Twitter is or what YouTube is. I mean, I remember some doctors pulled me up and said, look, Rahan, it's not right that you're doing these video blogging on the internet. Now, it has a name, it's called a vlog. It's not video blogging, but it shows like the lack of awareness of what these videos are, what the purpose of these videos are, and essentially the power of these videos. Now, so going back to first or second year, there was a video that I made, and I was running a little bit late for my lectures. Now, it was a very simple thing for me at the time, and I was just filming the whole day. It was a day in the life, and I was a few minutes late to the lecture. Now, I accidentally mentioned that in the video, and I got called in to have a meeting with the medical school, and they phoned me up and said, look, we have to give you a warning, a professionalism warning, because essentially you're a role model for aspiring medical students, and you can't come across as being late to lectures. Otherwise, this is detrimental to the reputation of the healthcare profession or the medical profession. So I understood that, and it was a lesson for me, particularly to learn that, you know, there's certain things that you can't say, there's certain things that you can't show, there's certain things that, I mean, I'm sure we've all probably been late to a lecture before, but it's just you can't publicly say that and show that on a YouTube video when everyone is watching. So that's my sort of trip up to professionalism.
Yeah, thank you very much, and raised some important points there you might not necessarily think about when portraying your life online. So if Jonny, you'd like to talk about some of the things you might be wary of.
So with regards specifically to professionalism, the first thing I'll say is that the conversation has moved on. I think a lot has evolved, even probably since you were a junior medical student, Ryan. When it comes to being on social media, there are clear guidelines, there are clear GMC rules, at least in Britain. So you just need to follow them, okay? Don't do anything stupid. And if I think I would like to hope that, I mean, being a Newcastle grad myself, they have up there got a little bit better at, you know, in terms of awareness and understanding that social media has now become quite a crux of our both professional and personal lives. Obviously, touching on the elephant in the room being the horrendous article that was published this week. Well, it was actually published in December. I'm surprised it's only come out now. It goes without saying that was a horrendous sort of privacy breaking, creepy article with poor methodology and couldn't stand up to any scrutiny. And it's outrageous that it got past peer review. It was crap. But I think what the authors in there actually managed to do was encapsulate the archaic view of professionalism on social media that these sort of social media cynics often take on. People who doubt social media and the power of social media will say that, oh well, we couldn't be on social media because it's too risky, too much unprofessional stuff. A lot of the old literature, I'm currently doing a systematic review on social media and its outcomes in med ed, and a lot of the old literature is talking specifically about that and about how it's too risky to be on social media and looking into the professional behaviors of students on social media. I think we're past that. There are more nuanced conversations that we need to have about professionalism and about the risks of social media. We need to be talking about things like toxic environments. We need to be talking about things like trolls, bullying. There's all of these things exist, and they are significantly more complicated than just saying don't be a prat on social media. Yes, you need to be a role model. Yes, you need to realize your responsibilities. But let's be a little bit more academic about it, and let's be a bit think a bit more clearly about it, and promote positive conversations, promote positive atmospheres, and the med bikini issue was a prime example of the community coming together to combat that.
Yeah, I think you summarised that perfectly, Jonny. So thanks for that. So we'll move on to Marina now, if that's okay.
Hi everyone. So I would say that with social media, you've got to be really careful, particularly as you become more involved in national organisations, on what you do write on social media. Now, for example, and this is a personal example, but I do regularly get approached by journalists, and I have been asked by 3 government select committees to write evidence to inform parliamentary policy. And I am very careful with what goes and not just what I tweet, but also what I retweet. And we all have a duty to ensure that we only retweet content that is accurate, because you don't want to find yourself having to justify to some form of select committee or some body the quality or the accuracy of the information that you post on social media. And you also don't want to put yourself in a situation where you are deemed to be an inconsistent person. So somebody who writes information that does not add up or that is wrong. So there's a reputational issue at stake, and it is about the reputation of the profession. Doctors are one of the highest esteemed professions, and we all have a duty to tweet and retweet content that is accurate and correct. Thanks, Jonny, for highlighting about the GMC guidance on social media and transparency. I also want to add to that I have seen some cases recently of people who don't want to identify themselves on Twitter. And I think that's a really difficult question. Should you have the right to be anonymous on Twitter? Now, the GMC guidance is really clear that we should all declare who we are on Twitter, as it's partly a form of transparency. But I do think that's an issue, not being able to identify people or specific individuals who make comments, particularly ones that then go viral, because it becomes really difficult, in my opinion, to take any of those comments forward or to act or use those comments to inform policy or influence policy in a positive way. And the other thing I want to say is that from a research perspective, the evaluation of social media in the context of research is very much in its early days, and accurate data forms and metrics and tools to evaluate social media, well, that's all very, very early in its stage and in its days. And we all, as part of the peer review community, we all have a duty when we're asked to peer review something, that we do actually peer review it and do it justice. It's really easy. Certainly when I worked at the BMJ, we used to see lots of articles. I know Ryan's smiling. It is our duty as reviewers, even though it's not a paid role, we all have a duty to review evidence robustly and fairly, and I mean fairly and robustly, but also accurately. We all have to consider that our opinion is one of those final steps often to something being published. And that's really important, because it's essential that the quality of what is out there is brilliant and is top notch. And the process behind peer review is a really, really important one. And if you don't feel confident in peer reviewing something, it's fine to ask someone and it's fine to not do it. But don't just click, yes, this is fine, without properly appraising or evaluating the content, I would say, within the piece. And the final point I want to make is about online safety. Jonny and I will certainly know that there is one example is there's a very influential lady nationally who I adore and respect very highly, and unfortunately she is in the middle of a battle whereby a specific individual repeatedly writes awful posts on this individual's tweets. I am most concerned by it, and I have personally written to Twitter several times. I know others have as well. But we all have a duty to report something online if we think it isn't right. Please don't just go along with the flow. We're all individuals, and it can feel really difficult to report something that doesn't seem right. But as doctors and as professionals, we are of the most professional people who use Twitter, and very much sort of we do have skills and insights into content that perhaps a layperson may not have. So if there's something that's factually incorrect or something that targets a specific individual, as a community, I think it's nice for us all to come together and say, you know what, actually this could be done a lot better, and we want a safe online platform, and we want to support a nice online platform that distributes good quality content and that enables us all as a network and as a society to contribute and make a positive influence. Thank you.
Brilliant. Thank you very much, Marina. Brilliant points there. I think we all need to be wary that everything out there isn't always true, isn't always nice, isn't always high quality. And I think at least being wary of that is a start. So just finally, Karen, your thoughts on what to be wary of?
Well, I'm, really appreciative of what everyone said, and I'm also really loving reading the comments. And I think one thing that's really coming out in the comments, and one thing that I'd like to emphasize, is that health is inherently political. I think there's a view that doctors are these objective beings that are neutral, that just work in the face of health, but health in and of itself is political. And I think what we're seeing with 2020, the disparities that 2020 really has uncovered through COVID, through Black Lives Matter protests, we've realized that doctors have the capability to be agents of change, to advocate for, those who don't have access to health, who receive discrimination who have poor health because of social determinants. And I think we do have a duty as doctors to call things out, to draw attention to things, and specifically also to talk about our role in advocating for better access to health and to, I guess, improve that overall. Now, should we be controversial on Twitter and controversial on Instagram? I mean, I think it's a very personal choice, and I definitely agree that you should really be thinking about if what you're saying is evidence-based, if what you're saying is politically correct. But also, I do think that we do have a responsibility to advocate for the broader community, and that's something that we can do. I do think we have to be a bit more careful than the general community. I think that our Twitter accounts probably should have a bit of thought before we do write anything. I would encourage doctors, medical students, nursing staff, or anyone who works in health to be aware that health is political, and by working in health, we are political agents, and to use that power. Listen to us.
Thank you. Yeah, I think I agree. The healthcare is inherently political, I think, especially if, like in the UK, your healthcare system is government run, then of course, like any political issue, there's going to be disagreement over it. So we've got a couple of minutes left. So I thought if you could give one piece of advice or some tips for people in the healthcare profession for using social media, perhaps as a blog or just their personal media, what main piece of advice would you give them about the power of social media?
I think have an aim as to who you're trying to reach out to. Have a target group that you're providing a voice for, maybe offering some inspiration, and also trying to help. I think social media is a great tool to empower minority populations, and that's personally for me. Now, I understand not everyone might use social media for this purpose, but that's what I believe is the power of social media. So in my opinion, have a target audience and just know who they are, and try and help and reach out to them. Not only will that boost your social media following, just because what you're essentially doing is a targeted business segment model, but also it provides them with someone to look up to, someone to follow, and someone that will give them guidance.
Brilliant, thank you. And Jonny?
I would really say that we've been talking a lot about the negatives, and that's fine. It's usually what I natter on about when I go on these talks. However, I don't want to undermine the positives of social media, because this phenomenon is so unique, so new, so unbelievable. I have seen final year medical students have discussions about the definition of reflection with the head of education standards at the GMC. And you can't beat that. There was nothing else in the past that could do that. Social media has the power to unite. It has the power of community, and it will help you learn, as long as you're coordinated and careful about it. I think you should have role models, and you should use it to advance your career if possible. Ask people for help. Just slide into their DMs. Ask them for any support, any advice. Use it to work on scholarship or get your foot on the ladder and things. Social media gives you a platform. It flattens hierarchies. The evidence is out there for this. So that's a bit of advice I would say. Use your opportunities, be safe when doing it, but also enjoy it while doing it, because our predecessors never had this opportunity, so you may as well use it.
Absolutely, thank you very much. And really quickly, just Marina.
I would say that with social media, values really matter. We all know that being fair, being kind, being inclusive, being diverse, and all being able to contribute to the dissemination and the collation of knowledge is really important. I'm just going to touch very briefly on one final thing, because we haven't said this before, but there is obviously guidance around patients contacting us on social media, and the guidance is very much that our profile should not be public, and we should keep our profiles fairly private. I know that's easier on Facebook than it is on Twitter, but that's just something to think about, is what do our patients think of what we write?
Brilliant, thank you. And Karen, your closing thoughts?
Well, I'm going to end on a little bit of a positive note to say I love what everyone said, but just to give a completely different angle, social media can be absolutely hilarious. I mean, medicine is so serious sometimes. We're focusing on death, disease, dying, suffering, inequalities. But at the end of the day, especially in medical school and for the 10 years afterwards when you get to study for exams, you can go on TikTok and learn about platelets in a way in 60 seconds that's better than I've ever learned in medical school. Or you can look at a funny meme and learn about a topic in a way that you've never thought of before. I think with medicine, there is so much seriousness and so much stress there. Medical education, SOMED, social medicine can be a way of humour, and humour in and of itself can be a learning experience. So I absolutely love it. I think it's a really exciting time, and I think the power of humour in medicine cannot be underestimated.
Definitely. I think the only thing that got me through first year was a page on Instagram called Niche Memes for Medical Teens. And that was good. That was good. I did appreciate that. Brilliant. Thank you all so much for joining me on the Power of Social Media Talk. And thanks to the power of social media, we can carry on this discussion on Twitter using the hashtag VHCC2020, because there's lots of questions we didn't get answered. So head on Twitter, Facebook or Instagram, and we'll try and continue the discussion there. So thank you very much all, and take care.
Thank you so much.
Thanks everyone.